Good afternoon. Warm welcome to all. Today, shortly, we are discussing how to make healthcare affordable in India. Few points we are going to discuss as introduction. What decide the cost of healthcare? Who can make the healthcare affordable? Strategies to affordable cost of healthcare. Summary, conclusion, and references. The Constitution of India mentions that every Indian citizen is entitled to free health care. The Constitution of India says that everyone should get free health care. The healthcare characteristics: affordability, accessibility, availability, acceptability, appropriateness, adequacy, and comprehensiveness. These are the characteristics are there of the healthcare of India. And mainly it includes affordability, means every individual will get the health services at the affordable cost or free of cost. Factors that decide the cost of healthcare. First is government. Available healthcare facilities of the government, mostly they are free or very low in cost. Taxes on the healthcare products and services. Government mainly keeps very low, and when they are getting the taxes, on the basis of that they are providing the health services. Second is the technology. So low cost appropriate technology will provide adequate and quality care in affordable cost. Health insurance, most of the health insurance with the low cost, they are providing maximum health services. Patient characteristics, health status of the population. If person is healthy, there is no need to have expense on the health care. Availability, demand and supply. Administrative cost mainly depends upon the 5 M's. As you know, these are the man, money, material, measure, methods. Facility and quality of the healthcare. Quality of the healthcare, many times we feel that it is costly, but it prevents many complications. So ultimately, it is affordable cost of care. Who can make the affordable cost of healthcare? First and most important, the individual, patient, doctor, employer, government, nurse, voluntary health agencies. Individual stay healthy, so there will no expense on the disease care and minimal expenses with the health care. Keep same health team network. So if the network is changed, there will be additional investigations or other activities are there, it will cost more. But stick to the treatment. If you are taking continuous and proper treatment, there will no complications or there will no lacking of the drug effects or there will no resistance of disease. So better to stay healthy. Visit to the specialty when your family doctor has advice. So family doctor will advise, then and then you have to visit to the specialist. Ask for the discount or concession whenever you are taking, wherever you are taking the healthcare. Have the health insurance. Every individual has to have health insurance policies. Get ESI benefits, especially for the workers, that is Employment State Insurance Schemes. It covers all the health services to the worker. See the support services from the various areas. It may be some voluntary health agencies are there, social groups are there, they are providing the help. Use of the public health services at the maximum level as they are free or very low cost. Keep the separate budget or money for the health. Every month you have to plan for some amount for health insurance or for health. Discuss the end life issues with the families. Doctors, how they will reduce the cost? First, reduce unwanted admissions. Only wanted admissions and particular time their admission duration will be there. No healthcare cut practices. Cut practices, wrong practices, unnecessary investigation or unnecessary treatment that will be prevented. Do not need do only needed tests and procedures. Low cost therapeutic alternatives are available, especially using of the generic drugs or Ayush, Ayurveda, Yoga, Unani, Siddha, and homeopathy. This is Indian medicine system is there. Its cost is comparatively low. Conduct the research on cost effective health care. Advise the generic drugs. These are very low cost. The picture says that prompt treatment, so no delay complications and recovery is fast. No defensive medicines. In case of the legal fear, conducting various treatments, advising the costly drugs, it has to prevent. Free treatment to the needy and poor. Hospital employee, third group is there. Right use of the services of high paid person. Quality of healthcare measures. Ultimately, it reduces the cost by preventing complications, stay of the patient. Use standard infrastructures, drugs, equipment, and healthcare policies. Use of modern technologies and information technologies to save the records, to identify various problems. More outreach healthcare activities. Instead of giving the health services at the hospital, better to reach at the home and give the services at the lowest cost. Implement the national health programs. Mostly they are free. Maintain the work culture. So work culture will prevent many wrong practices or cut practices. Accreditation of the hospitals. So there are some facilities are there for near and reserve categories. So they will get right kind of the treatment and low cost. Make available services of the financial advisors. It may be at the hospital level, they will give the advice where what are the various financial resources are available. Nurse is the main key person in the reducing cost of healthcare. Right use of the all things, no wastage. That is effectiveness and efficientness. Make awareness about the importance of health. Stay healthy, so no disease, no waste of the money. Consult the nurse before with the doctors. So she will guide primary level, and if it is needed, she will refer to the doctor. Guidance on the various health schemes available for various individuals. Provide the health care at home. Provide the preventive health services to all, because low cost, simple activities prevent many diseases or major health problems. New health education for health and wellness. He has to play the multiple roles, not only taking care of healthcare, financial advisors, consultant, various roles he will play. Conduct the researches on cost-effective health care. Government establish the standard public health settings. Nowadays, you have to see, especially the urban centers are there, sub-centers are there. These are well established and providing maximum health services. Ayushman Bharat is one of the example. Set, set the national health programs and implement effectively. Make the health laws, so there will be no health problems or spread of the health problems. Make the health services available at free or low cost. Use of PPP healthcare. PPP healthcare means public-private partnership. Control the cost of healthcare, use of generic drugs, and reduce the tax. Voluntary health agencies, mainly they are taking part by providing various activities. They are providing financial, education, material, and services. World Health Organization, UNICEF, Red Cross, Family Planning Association of India, Indian Red Cross Society, Indian Council for Child Welfare. Strategies to reduce the healthcare costs. Stay healthy, first and very important one. Healthy habits, balanced diet, exercise, adequate sleep, personal and environmental hygiene, immunization and specific protection to prevent accidents or diseases, periodical health checkup and follow-up of the treatment. Don't leave the treatment inadequately or short duration. Health insurance schemes, government and private, they are providing with the low cost, they are providing maximum health services and quality of the healthcare. Ayushman Bharat, one of the government yojana is there. Pradhan Mantri Suraksha Bima Yojana, Aam Aadmi Bima Yojana. Central government health schemes are there for medical care. Employment state insurance schemes, ESIS is there. Janasri Bima Yojana for poor, universal health insurance schemes for all BPL members, Mahatma Jyotiba Phule Jan Arogya Yojana. Telemedicine, this is a recent trend to using the telephonic and computer devices. Health services are provided at the place where the doctors and patients are there. So the cost of care will be reduced, no transport, no stay. Home care, so prevention of many diseases, simple measures are there. No defensive medicine, no extra medicine or investigation just because of fear of the law. Everyone can donate money, medicine, things to the needy persons, especially the patients who are recovered or who are expired. They can provide their drugs or they can donate the drugs. Take help of the social, religious, and professional groups. Ask for the help to the rich persons. Bank facilities like credit cards are there. They also give certain concession of healthcare payments. In short, the base of healthcare intervention is the cost. Educate the people and take the action on above strategies to make the healthcare cost affordable to all. The task is difficult but possible. By joining hands together and provide information, give help with these things and financial support to the needy one. In conclusion, I would like to say, in my lifetime, for every citizen of this planet to get the health care at the price they can afford to pay without having to beg or sell something. These are the few references are there. Thank you for listening patiently. See you again.